We all know that cystic fibrosis is also becoming so common nowadays in India. It is as common as your tuberculosis. Do you believe? Abroad, bronchitis is broadly classified into cystic fibrosis and non-cystic fibrosis bronchitis. Here in India, cystic fibrosis, primary ciliary dyskinesia, primary immunodeficiency are increasingly being recognized in the past 1 decade. So these disorders will be as common as tuberculosis. So while coming to cystic fibrosis investigations, how to suspect cystic fibrosis were discussed in the previous session. Now the discussion will be focused on investigations like Aquagenic Wrinkling Test, Immunoreactive Trypsinogen, test for pancreatic insufficiency. These are all indirect tests. Direct tests like sweat chloride, CFTR test, nasal potential difference. What is this lung clearance index? These are all the things we are going to discuss right now. But first of all, whom to be investigated for cystic fibrosis? The answer is one who has got typical clinical features of respiratory problems. Upper lobe, diffuse bronchitis, more so upper lobe bronchitis. Meconium ileus, recurrent pancreatitis, neonatal cholestasis, distal intestinal obstruction. The manifestations of CF manifestation of gastrointestinal, genitourinary, congenital absence of bilateral vas deferens. When any one of these typical clinical features are present, along with a history of CF in the sibling, or history of CF in the sibling, or positive newborn screening test. What is this positive newborn screening test? Let's discuss. Either you should have the symptoms, or your brothers or sisters should have the symptoms, or your newborn screening test is positive. If it is positive, I need to do 3 tests, either sweat chloride test or CFTR or nasal potential difference. At present, apart from doing sweat chloride test, majority of us are planning for genetic test, not because genetic test is becoming cheap and economical nowadays, also because we can plan management with correctors, potentiators based on the mutations that is present. Okay, right. So let's go. First of all, as a resident, you need to know what is called aquagenic wrinkling test. A child with meconium ileus, a child with neonatal with persistent respiratory distress, recurrent pneumonia, collapse, neonatal cholestasis, under a child with pseudo-Bartter syndrome. In all these instances, you need to suspect cystic fibrosis. It doesn't mean that you need to directly go for test. You need to know the test that is subjective and that can be done by yourself. That subjective test that can be done by yourself is aquagenic wrinkling test. What is this aquagenic wrinkling test? You keep the hand of the child, one hand free to compare. Another hand you need to immerse in bowl full of lukewarm water or tap water. At the end of each and every minute, you need to take the hand that is immersed in water and compare to the hand which is kept out of the water. In children with cystic fibrosis, exaggerated wrinkling of the hand that is immersed in water will be seen within 3 minutes. It has got very high sensitivity, but specificity is poor because it can also occur in other conditions. But to me, my dear residents, it is the very best initial screening test whenever you suspect a case of cystic fibrosis. Please try to do this aquagenic wrinkling test on day-to-day basis. Right? Then comes the newborn screening test. The newborn screening test is nothing but immunoreactive trypsinogen.